Bologna freezes the tissue of the ovaries, beats the tumor and becomes pregnant. Bologna returned to life after defeating the tumor and get pregnant spontaneously after having frozen their ovarian tissue to keep it during treatment. It is the incredible story of a 34-year-old woman, patient of the Santor Sola Polyclinic in Bologna, the first case in Italy of this kind. "It's a great result, we are proud of it," comments the general manager of Santor Sola, Antonella Messari, "that gives us hope for the future." At the age of 29, the young woman was diagnosed with non-Hodgkin's lymphoma. Before undergoing radio and chemotherapy, and later also in bone marrow transplantation, the patient decided to freeze part of her ovarian tissue. After 5 years, and declared healed, the patient was in an early menopause. At the 6th week, the woman asked to be reimplanted the preserved tissue in 2 places, in the ovaries and subcutis, in the abdomen. In this way the ovarian functions were reactivated and this allowed her to obtain a spontaneous pregnancy. What time has come to the 6th week? "We visited 2 days ago," explains Renato Serracchioli, director of the unit of gynecology, whose team performs these operations. "There is the implant in utero and the heartbeat. We hope that now it goes on in the best way." As Serracchioli explains again, it is not a frequent event. There are about 100 pregnancy cases in the world with this technique. In Italy the first case occurred in Turin a few years ago, in a woman who suffered from beta-dilatemia. The case of Bologna is the first in a cancer patient. The surgery. Cryopreservation of ovarian tissue is a technique that is evolving and has great potential, continued Serracchioli. "When it is optimized, we can restore the possibility of a normal life and a pregnancy to many women." The operation is performed in laparoscopy. A part of cortical tissue is removed from the ovaries, 1 or 2 mm thick, whose follicles are less susceptible to damage due to frostbite. The explanted part is then cut into strips of a few millimeters and each is placed in a test tube with a solution that protects the fabric. "We need to treat it with hands of silk," explains Raffaella Fabbri, head of the cryopreservation laboratory. "The fabric is very sensitive to trauma. It takes a lot of experience. We have been working on this procedure for 20 years. The test tubes. The tubes are placed in a programmable freezer that reduces the temperature up to 150 degrees below zero. Finally, everything is transferred to the cryobanca of Santor Sola and stored in liquid nitrogen. That of the Bologna Polyclinic is a reference structure at a national level. To date, 703 cryopreservations have been made, of which 550 from adult patients and 153 from pediatric patients. There is also the tissue of a 2-year-old girl. Oncology centers from all over Italy contact us, underlines Serracchioli. The same patient left pregnant is from outside Emilia-Romagna. The cryopreserved fabric resists without damage for at least 18 years. The reimpianti performed so far were 16 and 13 patients, with positive results in 80–90 of cases. The request to replant the tissue is not just for reproductive purposes. Cryopreservation. From the strictly reproductive point of view, however, the technique of cryogenically conserving ovarian tissue is different from freezing oocytes. And it gives more chances of getting pregnant. The freezing of eggs, explained Serracchioli, is functional only for the reproductive purpose, but does not give many possibilities because few oocytes are stored. With cryopreservation of the ovarian tissue, however, there are more possibilities and more time because the follicles in the ovaries are stored. Furthermore, the hormonal recovery has not only a reproductive purpose. With the freezing of the ovarian tissue, in fact, we give the woman the possibility of having a complete recovery of the ovaries' function, as if she no longer had all the oncological therapies that brought her into menopause. Use for puberty. In the case of girls in particular, explains Fabri, this technique can also be of great importance in inducing puberty, if the fabric is taken first. It is a question of activating puberty following the reimplantation of ovarian tissue in these girls who have made treatments that have completely destroyed their ovarian function. At that point, reimplanting the tissue, puberty was reactivated.